Hi, how are you doing? It is Sunday, October 1st, 2023. I'm Delaware State Representative Paul Baumbach. I also serve as the co-vice chair of the Retiree Health Benefits Advisory Subcommittee. And this is our time for a weekly update on the RHBAS and related issues tied to how the state will provide and pay for benefits for our state retirees, health benefits for our state retirees. So welcome. And I think some of you may have seen the video I loaded up on YouTube and into Facebook on, I guess it was Friday afternoon, regarding tomorrow's State Employee Benefits Committee meeting. And if you did, thank you. If you have any questions, feel free to post them here. But I'm going to focus on this past Wednesday's meeting of the RHBAS. There wasn't any dramatic events that went on there. But I'll still go through everything that transpired on Wednesday and talk about what's coming up. So with that, we're going to go to this. There we go. Okay. So what our meeting agenda was we went over the meeting minutes. We discussed the status report, and there's a whole lot of history of this, but it's just sort of suffice it to say that there was a need from attending the State Employee Benefits Committee that apparently their co-chairs felt that they needed to have the recommendations that our subcommittee has made for the SEBC in writing in a report, even though there's no such statutory requirement. So we decided we need to do a report, and then somehow that idea of a report got expanded to it has to be a comprehensive year-to-date, all the activities of the RHBAS, which meant it was going to take a long, long time. So anyway, that's what the history behind the October 1st status report. October 1st is today. That date was chosen before tomorrow, and tomorrow is when the State Employee Benefits Committee is meeting, and their meeting at which it is understood that they will be considering, notice that's the gerund I'm using, not necessarily voting upon, but considering, not necessarily approving, but considering their the request for proposal for the next multi-year contract that provides health care for Medicare eligible state retirees. Then once we get past the report, we have a few other things on our agenda. It's to look at what we do for pre-Medicare age retirees for their health benefits, those who are not grandfathered, whatever that, I'll say, grandfathering means two things, two different groups of people. I'm using it here in terms of a cutoff date. Those who either were hired after a certain date or retired after a certain date would be non-grandfathered and therefore subject to change of benefits. So what kind of changes would we consider? And what this agenda item is we'll get to talks about what are our goals? If we don't know what our goals are, then how can we decide what to plan, what changes to propose? So let's discuss what our goals are. And then number 5 is look at funding. Really, this is the open-ended thing, funding, eligibility, plan design, etc. What are the things we need to work on? Number 6, it was our work plan for remaining meetings. 7 is essentially open discussion by the subcommittee. Then to the extent that all that gave us some more things to report, to put into the October 1st status report, and let's get back to it and fit those in. And then we have public comment, then we adjourn. So it's a pretty full agenda for Wednesday. It was billed as a 2.5 hour meeting. It actually was limited to 2 hours. We lost the room at 3:30 instead of 4 as advertised. So, but that was the meeting on Wednesday. So this is the report. Now, I'll say I was disappointed that this, how many pages is this thing? 16 plus pages of report was not shared with the public by the subcommittee in advance. And yet we were in theory reviewing and voting upon it. In my eyes, it's as bad practice as what the SEBC is doing with this RFP. But as I understand it, an early copy of this did get out to many retirees, and we did get a lot of public comment in writing in advance by retirees on this interim report. And But as you can see, it goes on and on. And what a lot of the language, a lot of the comment we got back took issue with various phrasings having to do with, was a meeting necessarily a public meeting, having to do with, if the agenda was not complete, things like that. And it became a little contentious at times. So I'll say that our committee member, Wayne Emsley, took up the responsibility and did a great job of trying to, in advance, reviewing a lot of the submitted comments ahead of time, trying to find common themes and trying to find ways to incorporate them without antagonizing any parties. And then in the meeting, we did a little more wordsmithing, trying to come to mutually agreeable phrasing. But while we were doing that, we jumped to the next piece, which is a abbreviated report, special report that I prepared. I think it had one change to it. No, I don't think it had any changes to it. And so this was designed as a 2-pager, much easier. While it was available ahead of time, I don't think it was posted ahead of time. But it looked at only what we needed to report. The purpose of this report is to make a record of and to formally inform the SCBC of relevant work and recommendations made by this subcommittee, particularly those that relate to the RFP to be approved by the SCBC this Monday. So it really narrowed things down. It pointed out the background to the RHBAS briefly, pointed out 17 public meetings, lots of public comment, and noted that we reviewed an awful lot of information, and that after deliberation, the subcommittee has approved several motions related to the RFP, including that it pointed out that we did not think that anyone who's currently retired, and even those who retired by the end of 24, none of them should get any changes. They should be, and the phrase here is important, entitled to special medic fill plus prescription benefits or something substantially equivalent, with no changes to the state share percentage. They wouldn't have to pay more than that 5% max they currently pay of the premium once they're Medicare eligible. That was done in early August. The other motions were done in late August, or late August meeting. And motion number 2 had said that the RFP should not request anything to do with Medicare Advantage. Motion number 3 said that this RFP should be shared, this draft RFP should be shared with the public in advance, that the SCBC should invite public comment prior to voting upon the final version of the RFP, and that the discussion and vote should be in public on that at that meeting, which would be Monday. I will say that I don't have much confidence that the SCBC, I know the SCBC hasn't officially discussed this third motion about how they should handle the RFP before Monday's meeting. At Monday's meeting, they'll be discussing this, but I am certainly disappointed given that both co-chairs of the SCBC sit on this subcommittee, and neither one felt that it was appropriate to raise this recommendation to the SCBC in time for it to adopt this recommendation, which by definition has to be in advance of the meeting. So that's the third one. The fourth one is that the contract that the RFP is seeking, it's recommended to be for a 3-year term, not a 2-year term, which we learned in August. The SCBC planned to change it, reduce it to 2 years, which means that retirees who have been gone through the emotional tug of war with the state over what their retiree health benefits would be will have to go through this a third sooner, after only 2 years, rather than having 1 additional year. The normal 3 years is the base for this contract. So let's say that this contract goes the way we hope, and it doesn't have any Medicare Advantage in it, no pre-authorizations, no networks, all that sort of stuff. So this one's done well. Well, in 2 years, we'll be facing the same questions and the same turmoils if the SCBC original current plan for the RFP holds. So instead, the subcommittee recommended that it be done with a 3-year term. And finally, it said that the last recommendation, which is related to the first one, but different a bit, is that all changes should be restricted to those employees, only those employees who are hired after 2024. So, and it points out where all of our information is, then all of our members. So I will say, it was designed to be short and sweet. It was designed to not editorialize, not to throw anyone's opinion in, but just to report the facts. So that was the final abbreviated report, and this was adopted by acclamation by the subcommittee. We then reviewed a very brief presentation, and this looked at what happens if you, and so this is for, this looks at Model C, so people who retire after 2024. And it says, okay, if we have our payroll funding from payroll stay at 0.36%, not go up, we have the 1% of the budget carve out done. And what if we charge future retirees roughly $100 a month more? And that can come from a combination of charging them 10% instead of 5% of their premium, and shifting from something like Medicfill to something like Medigap G. And what we find is that it gets us from just below 60% to about 63.5% of filling the gap. So that was the only presentation, and the additional presentation that was provided. So that was there. Then we went in and we had Joanna from the Department of Pensions, Office of Pensions, present a few slides regarding what if we boosted that amount from payroll that goes in. I've got a sheet here with some words. I got a table here, and this looks at it. What if we increase it by 0.25%? So it is, if you look right here in this column here, starts at 0.36%. What if starting in fiscal 25, we boost it to 0.5%, then 0.75%, then 1%, and keep it going up until the point where it has enough money in the system that the funding that we've set aside pays for the money that's needed every year. So what this does is payroll, the total cost of the budget that goes towards healthcare. So that's paying for your current costs and paying for your future costs. So getting that, paying towards that 30-year out projection of what retiree costs are going to be, which would come both from the budget, the 1% carve out, and this growing percentage of payroll. What you see is that currently, we're currently in fiscal 24, we pay about 6.6% of the budget for all that retiree health benefits, and saving for future retiree health benefits, about 6.6% of the budget. This will have us go up to about 10.7%, so an additional 4% of the budget over time as this payroll percent keeps increasing. And at that point, it drops down to 5.7%, which is less than what we're paying now. So this says, okay, it takes us 20 years, but in 20 years, we will have not only gotten enough money into the system, it gets us up to about a 76% funding level, but it also lets us drop down our amount of the budget that goes towards healthcare down to less than 5.7% a year, much notably less than what we're currently paying. So that's one approach. And then the second page of this looks at if we increase by 0.5%, and what you see is we get there faster. We get there in 17 years or so. It does have the amount of budget taken up increasing faster and to a higher point, and then dropping again to under, in this case, under 5.6% instead of under 5.5. It gets us up to over 12%, close to double what we're currently doing. Also notice that it gets us close to 80% of the funding level. So what does this tell us? Well, what this tells us is that if we use the 1% budget and we use the increasing the payroll percent from the current 0.36% up to eventually up to 5.5% over many decades, it's at I'll say, digestible pace. It will get us where we need funding wise, and this assumes no changes in plan design, eligibility, etc. All this is a funding only solution. What this tells me is that whatever savings we can make, we should make, and I say can, at both what we think is fair, what we think is best for the state, but also best for retirees, either current or future retirees, either current or future employees and when they retire. So whatever changes we can make to cut the costs, we should consider that. But we know that ultimately, as long as we keep writing the checks out of the budget, we can be closing this gap through funding, and we can do it over less than 30 years to get there. However, to me, this is as I said at the meeting, this is a last chapter. Increasing the payroll is something we know will get us to the finish line. But we know we've already done the 1% of budget, which is a big piece of it. Now what we know is let's work on the eligibility, any kind of changes we may consider there. And then once we have that set, we can then work on the payroll amount. We know it will bring us to the finish line. And to the extent that we've got other savings built in, it'll get us there faster. So it's good to know it's there. This handout was given, it gives you a head count of current employees, pre-Medicare retirees, and what plans, well, that didn't work very well, did it? What current plans they use between the different employee health benefit plans. Because if you're less than 65, not eligible for Medicare, and you retire from the state of Delaware and you've earned the right for retiree health benefits, you are choosing from the same plans that our current employees do. There's a single group of both current employees and current pre-Medicare retirees and their beneficiaries. So anyway, it gives you a head count on them. Say Delaware participating group retirees. We've also got groups. I think it could be firefighters, police, employees of Del State. I'm not sure which, but I'll say related to the state of Delaware. We have participating groups who are also participating in these plans before they hit Medicare age. And get rid of that guy. So then the last piece of the handouts, did we hit that? Yeah, okay. Last piece of the handouts is a motion I prepared, and but because it only got to our members on Wednesday, what we decided is to table it until the next meeting and see if we can see if there's any small adjustments we need to make and see if we have enough votes to pass this. And the whereas is build the case. You can just jump later on. And it says the General Assembly, so this is a recommendation to the General Assembly, was to create a subcommittee to, and it currently says SCBC, that's been changed to be the Healthcare Commission, and a task with studying best practices to control healthcare pricing. And if you go back to the whereas clause, we are within the top 12 most expensive states for healthcare, both inpatient and outpatient. So that's one of the reasons that we have this big gap in our retiree health benefits plan, is that in Delaware, people, including the state of Delaware, pay a lot for the healthcare. And therefore, if we can get the healthcare cost to come down, some estimate somewhere in the 10 to 20% range is certainly possible if we wanted to come towards what some of our neighboring states are paying, that can do a significant amount of closing the funding gap. So this says, ask this General Assembly to form a subcommittee under the Healthcare Commission and to study all of this, including what some states, including Colorado, Montana, Maryland, Oregon, do, and that make recommendations. So that's a motion that will be taken up at the next meeting. That's the last of the handouts. I don't have questions yet, and therefore what I will do is, actually let me look at, can I go here? Yeah. So, right, I did the video I did on Friday went over how the RHBAS relates to the SCDC and talks about the RFP. We have the meeting tomorrow. We will see what comes of it. It's up to the SCDC, how the SCDC members themselves, and frankly, a majority of them, how involved they wish to be in the consideration and approval of the request for proposal, and what is in there, and how they want them incoming contracts to be rated. Therefore, what elements are most important to them, and also to the extent how much the SCDC members wish the public to be involved in this discussion and decision making. So that's what's going on. The meeting starts at 2:00 tomorrow afternoon down in Dover. It'll be live streamed also. You can testify remotely or in person. I plan to be there. At this point, I believe it's possible that our subcommittee's chair, Lieutenant Governor Bethany Hall Long, and I, as co-vice chair, will be jointly making a presentation to and fielding questions from the SCBC members. So those are our next steps, and I will likely do a quick update. Tuesday sometime. I got to figure out when I have time on how the SBC meeting goes. So I'm sure that there'll be some others who share their thoughts on that also. That's all I have for today. Karen, thank you for your comment. I want to say I've received some very kind comments by email in the past 24 hours regarding the video I prepared about Monday's meeting of the SCDC, and we will see what comes of that. Thank you very much. I hope you have a good rest of your weekend, and I will perhaps see you at the meeting on Monday, or if not, you may see me in my next update early next week after the meeting. See Nancy. Very good, Nancy. Thank you. Thank you also. I will talk to you all later. Okay, take care.